This Good to Go segment is sponsored by Spectrum Health Medical Group.
September is National Suicide Prevention Month, an opportunity to talk about suicide, its causes, and prevention. Dr. Adele Cadieux is a pediatric psychologist from Helen DeVos Children's Hospital, and she is here to create some awareness, particularly around kids and suicide. Dr. Cadieux, I know there are conflicting reports about the impact of the pandemic on adolescent suicide numbers, but according to the Pan American Health Organization, the pandemic has definitely exacerbated the risk factors associated with suicide. Do I have that right?
So there's definitely a lot of risk factors that the pandemic has impacted, just because a lot of kids have been a lot more isolated during the pandemic with not being able to access school or some of their social activities that they were used to. So it definitely, was very difficult, not just for the kids, but the adults around them. And so it was very challenging, absolutely.
So what are some of the warning signs that parents should be looking out for?
So some of the things that they might hear is they might hear their child or their adolescent, make statements about death or dying, or maybe that life isn't worth living anymore, or they may actually make some specific statements about wanting to die. Those are some of the more obvious things that let us know that kids are really struggling. But it might not be always that obvious. Sometimes it's more just expression of hopelessness or feeling like they're a burden, or they're just, that life is just really tough or difficult to cope with. Or you might notice that they're just a lot more withdrawn or irritable and sad, or that they're not doing some of the activities that they once enjoyed, like not seeing their friends as much or involved in their groups or sports. So you might notice some of those kinds of changes, and that might give you a clue that something's going on that you need to check into.
Yeah, that checking in is tough, though. How do you start that conversation? Because I always feel like, and this is wrong, I know, if you talk about it, maybe you plant the idea or something. That's not right at all, is it?
No, in fact, it's actually really important to specifically ask. But you're right, starting the conversation can be really hard. And so as a parent, we might not feel very comfortable starting the conversation with that kind of a question. So it's okay to start with simply asking, are you doing okay? And even if your child says yes, and you're like, oh, I'm not really sure that you really are, that maybe you're trying to blow me off. It's okay to kind of follow that up with, well, I'm kind of concerned. I've noticed this change, or I've noticed this difference, and kind of identify the things that you've noticed and why you're concerned. That starts to allow them to maybe identify, well, yeah, I haven't really felt like being out with my friends as much, or yeah, I just don't have any motivation for school anymore. And I don't care if I, turn in my math homework or not. It doesn't matter to me. I mean, what's the point of turning in math? It allows them to start that conversation so that we can maybe then get into the more specifics and asking that specific question. Well, have you been having any thoughts about suicide? And it's important to ask. We're not planting a seed. We're not giving them information that they haven't either already thought about or already completely dismissed because it's not something that they're considering.
Where can people find help in doing all of this?
So if you have immediate concerns for your child, that they're not safe, or that they're having these thoughts, using the suicide hotline is a great opportunity to seek immediate assistance, or using a local emergency department. Those are some areas where you can get immediate assistance. However, if you're just concerned and you're thinking, I think my child needs some support, then reaching out to we have a lot of behavioral health agencies in our community, Spectrum Health, our children's hospital, we have behavioral health supports and services. So utilizing those services is a great way to at least start reaching out and supporting your child, or at least helping to figure out what needs they have.
And what needs the parents have in walking through this difficult journey alongside their kids. All right. Well, we want to let folks know, for more information, visit spectrumhealth.org/talk mental health. You'll find resources, talking tips, lifestyle changes, and so much more. Dr. Cadieux, thank you so much.
You're welcome.